Clinical Psychology Studies, Anorexia, Holland et al. Aim. A variety of data suggests that anorexia may have a genetic basis. This study aimed to explore the possibility by comparing incidence of anorexia in identical monozygotic twins and non-identical dizygotic twins. Since twins are raised in the same environment, similarity may be due to nature or nurture. However, if monozygotic twins are more similar, this implies that genes play a greater role. Methodology, interviews, physiological data, procedures. 45 pairs of female twins were interviewed, where at least one twin had had anorexia. The interviews established the clinical characteristics observed as well as the occurrence of eating disorders in any close relatives. Records were also made of body mass and length of amenorrhea, and questions asked about drive to be thin and body dissatisfaction. In order to determine whether twins were identical or not, a blood test was used. There were 25 monozygotic twins and 20 dizygotic twins in the study. Findings. There are significantly higher concordance rates in the monozygotic twins. 25 or 56% of the monozygotic twins were concordant for anorexia, whereas only 1 or 5% of the dizygotic twins was. There was a significantly higher rate of anorexia in the relatives studied than found in the normal population. The rate of anorexia in the population in general is 0.1%. The study found 6 cases of anorexia among first-degree relatives, which is 4.9%, and in the second-degree relatives there were 2 cases, 1.2%. The measures of body mass, amenorrhea, drive to be thin, and body dissatisfaction indicated that these were heritable, as there was greater similarity between monozygotic and dizygotic twins. Conclusions. The findings from all 3 different methods of analysis suggest that anorexia has a large genetic component. The figure of heritability may be as large as 80%. In other words, 80% of the variation in anorexia is due to genetic factors and 20% to environmental factors. This high figure may be partly explained in terms of how genetic factors interact with the environment. What is inherited is a genetic sensitivity to environmental factors. Evaluation. Strengths. Many measurements were used for analysis in this study, such as blood tests, body mass, and clinical interviews. This adds to the validity of the results. A more recent study by Bulick et al. In 2000 concluded that anorexia is 56% genetic, thus supporting Holland's suggestion that there is a strong genetic link, although not as strong a link as suggested in Holland's study. Weaknesses. One difficulty with studies of anorexia is that the actual diagnosis in any individual is not that certain. Some individuals suffer from both anorexia and bulimia, although not always at the same time. This means that the genetic susceptibility may be to develop eating disorders rather than anorexia in particular. Gorwood et al. 1988 suggests that if we want to identify the genetic causes of anorexia, we need to identify the distinct subtypes more clearly. Twins don't just share the same genes, they also share cultural and family values, and the environment for MZ twins is far more similar than that for DZ twins. Therefore, physiological and environmental factors are confounded. Indeed, the 56% concordance rate in MZs might be entirely due to their more similar upbringing than DZs. However, Holland et al. Argue that MZ twins who actually look very different still have the same high concordance rates as MZ twins who look identical. Small sample. Many twins studies involve only a small sample size. Holland et al. Only studied 25 MZ and 20 DZ twins, and it is estimated that 15,000 pairs would be needed for a definitive study. Genetically. The low occurrence of both twin births and eating disorders make this unlikely, however. There may be reasons why twins are more prone to mental illnesses than non-twins, and therefore the findings may not be generalizable to the rest of the population. It is possible that twins may be subject to greater developmental difficulties, for example, sense of identity, or that they are genetically more vulnerable than other adolescents. There has been a dramatic increase of cases of anorexia in the last 30 years. Social factors such as the promotion of thinness in the media seem to be a more plausible explanation than genetic factors.